So many of us have been led to believe that it's only certain foods that are driving or triggering IBS, and it's often the first thing that we'll think of or be told to do. Do an elimination diet, like remove pretty much all foods and then slowly add them back in and seeing what's driving it. And then, well, that's just your lot in life. If onions and garlic are driving this for you, then you're never going to be able to eat onions and garlic again. Well, no, they're just sort of like what's triggering it at the moment, but not necessarily what's driving it. Like, you weren't born allergic to onion and garlic, trust me.
We need to actually solve the bigger problem underneath, so then those things don't trigger you anymore. Yeah, we can remove cauliflower and garlic and onion and never touch them again, but those things are always going to trigger if those big drivers aren't attended to.
Hello and welcome to PCOS Explained, formerly the PCOS Nutritionist Podcast. I'm your host, Clare Goodwin, a registered nutritionist and exercise scientist, specialising in PCOS because I have it too. Each week we'll uncover the latest research, share inspiring stories, and provide practical tips to help you thrive with PCOS. Whether you're newly diagnosed, you've been struggling with this for a long time, or supporting someone with PCOS, this podcast is your go-to resource for empowerment, education, and community. So join us as we uncover the tools to thrive with PCOS. PCOS Explained is brought to you by our very own service, Ovi. Ovi is your go-to health service for women with PCOS. We help you improve your PCOS symptoms and prevent the long-term complications of PCOS by giving you hyper-personalised health advice based on your specific symptoms and PCOS drivers. We have a range of plans to suit your needs, from a DIY app-based program to one-on-one consultations. You choose what suits your budget and learning preference. And we offer a result-based guarantee on our Premium Plus plan, meaning that if we don't help you achieve your goal, we refund your money. Ovi is available worldwide, so it doesn't matter whether you're based in the UK, US, Canada, Australia, New Zealand, or anywhere else, we can still help you. Welcome back to the podcast. This week we're going to be talking all about bloat. Such a common symptom, and one, Emma, that you have personally had so many years of experience with.
So many years, yeah, and I've done so many different things, which I can pop back up throughout the whole episode and be like, I've tried that, I've done this. But yeah, it really does come down to, it's a real elimination process, I think, and that's something that I've really found. And
by that you don't mean elimination diet, right?
No, I don't. It's like an elimination of what's causing it, not dissimilarly to how PCOS works with our drivers, but yeah, it's really important to find out what is driving your gut issues or your bloating, and then find the right path for you.
Yeah, totally. It's exactly the same. We were just speaking about that. And even to the point where they're kind of both syndromes. Well, not kind of, they are both syndromes. And what that means is that they both kind of have names just describing what they are, right? We talked about this, how like irritable bowel syndrome is just describing that you've got an irritable bowel. Yeah. It's like, yeah, no shit. I know that. I've known that for quite a wee while. And same with polycystic ovarian syndrome. It's like, okay, you've got these follicles or cysts on your ovaries as a symptom of what's going on in your body, this metabolic hormonal disruption. Similar to premenstrual tension syndrome. It's just describing what's happening. It's like, okay, you're getting tension in your premenstrual weeks. That's it.
It's just like a description of, and we kind of say this in PCOS as well, a constellation of symptoms, and you might have a set number of them, you might have all of them, you might only have one or two, but it's about essentially how can we put you under an umbrella to kind of describe what you're experiencing in your symptoms. Yeah.
So can you describe to us what bloat feels like? Because I think that this is something that often gets misconstrued, especially I find that a lot of patients describe abdominal weight gain as bloating, but that's not what bloat is. How does bloat feel?
Yeah. What we're talking about, that kind of bloating, is a full distension of your stomach. So it feels like, for me, it would feel like my skin was stretching. I would look 10 months pregnant, like ridiculously bloated tummy. Sometimes it's painful, more painful than just the stretching of the skin or like the distension. Sometimes there's like real sharp stabbing pains that can be associated with it, and that is often because of the trapped gas in your abdomen, on your gut, and in your digestive system. I used to describe it as, particularly when I was in the thick of it, My granddad had a dairy farm, and sometimes they would have to go around and stab the tummies of cows because they would get so bloated and distended because of the amount of like grass that they would chew. And so they would literally stab a hole, and I used to think, why can't someone come and stab a hole in my tummy right now and just let go of the gas, like let it all out like a balloon. So that is the intense pressure that you're feeling, and you just want it to go. And oftentimes some people might experience like gas with that bloating. Other times it's trapped and you can't get it out, and you actually can't pass wind, but it's trapped in your stomach and you know it's there. So I think there's, again, these all fall under IBS, but they're different presentations, right?
And some of it would lead to like extra gas and wind. Some, as you said, some people not, because they just can't even get it out. Sometimes it would lead to some people for like diarrhea, and others to constipation, or a combination of both. So interesting. I had this exact discussion with my daughter's daycare yesterday, because she's this massive side topic, but anyway, she's got some other symptoms. She's had constipation, also was an eczema baby, although we have resolved that through homeopathy. Another topic, amazing. But she's also getting recurrent like ear infections, even though she's had grommets. And I was like looking and talking to some naturopaths, and they were like, oh, that's a really common triad, like ear infections or tonsillitis and eczema and constipation or diarrhea. And so I was mentioning this to daycare because we might need to change her diet and have a trial of dairy-free for her, because that's again one of the things. And our daycare manager, she's amazing, and she was like, oh, I'm so surprised about that, because normally dairy intolerance leads to diarrhea. And I was like, interesting you say that. That's like not, yes, that can be true, but
for
not always. And so you might have heard perceptions that people with IBS get diarrhea. They always need to be going to the toilet, but that's not always the case. A lot of people, it's constipation or alternating diarrhea and constipation.
Yeah, it's the alternating, because then I think as well, there's a real fear. This is interesting. I think different people have different experiences. For me, I almost preferred diarrhea because there was a real fear of being the blocked up end of things, and that was more uncomfortable. So yeah, I think if you've experienced both, you might have a preference either way, which is horrible to say, but it's like you literally get to that like point where you're like, well, this is how I live now. Like stools aren't what they should be. You know, there's like the Bristol stool chart of what a poop should look like, and you're like, I'm either here or there. I'm never in between, or never in that happy medium range. So yeah, and that's another symptom as well, as like inconsistent or like essentially like unhealthy looking poop. But
the foundations of this bloat is that there's some kind of, you feel some sort of trapped gas or distension or pain, but some people might not experience pain. It's more just, but there is that real feeling of wind or gas or tightness trapped in there, as opposed to I feel larger in that abdominal area because of that's where my body fat accumulates, or I have
feeling
belly
like
fat.
Water retention often, or like puffy face can often be referred to a lot around bloating as well. And I think that's more swelling, I would say. There's swelling, which might be tied to another constellation of symptoms as well. But the bloating we're talking about today is particularly that distension, painful, gas-related one.
And I think that if you've experienced that, you'll be able to recognise that and be like, yes, that's definitely me. And if you can't resonate with this, it's probably more the like abdominal weight gain or the fluid retention. And we definitely have had, we've had so many conversations with patients about this, right? And it's amazing how that term bloat can be used for so many different symptoms. So we just wanted to make really sure that you know this, we're on the same page here, this is what we're talking about. So let's go through, I want to come back to what you found in all your trial and error, but when we talked a bit about the similarities with IBS and PCOS, that it's just describing what's going on, and there's actually underlying like drivers. So for IBS, what are some of those underlying drivers that are causing the symptom of an irritable bowel?
Yeah, I think there are a few things. I think we also need to like take a step back first and be like, there are things that are driving this, but then there are things that are also like maybe triggering it as well. So like in PCOS, our drivers we talk about are like insulin resistance or stress or inflammation or thyroid. The drivers for IBS or this particularly bloating and things, we tend to see those being something more like a term called SIBO, which we'll break down in a second. Like food sensitivities can drive this, and like inflammation within the digestive tract. parasites or something, and bacterial overgrowth. So we'll kind of like break these all down. These are kind of some of the big ticket drivers we see kind of really contributing to the presentation of these IBS symptoms. And then there can be other things that really trigger or set off essentially a bout of distension or bloating or things like that. So should we go into the drivers first and then we can break down the triggers?
And I think that that's a really good way of doing it, because so many of us have been led to believe that it's only certain foods that are driving or triggering IBS, and it's often the first thing that we'll think of or be told to do, like do an elimination diet, like remove out all the things that pretty much all foods, and then slowly add them back in and seeing what's driving it. And then, well, that's just your lot in life. Like if onions and garlic are driving this for you, then you're never going to be able to eat onions and garlic again. Or if, like the patient I had this morning, it was cauliflower that was really triggering that for her, and some protein powders as well. And so she'd been led to believe that she just couldn't eat those foods ever again. And I was like, well, no, they're just sort of like what's triggering it at the moment, but not necessarily what's driving it. So
exactly. And it's like we need to actually solve the like bigger problem underneath, so then those things don't trigger you anymore, I think. So it's like, I guess it's the same in like PCOS, where insulin is driving the acne, and yes, we can like wash our face and do all the things, but unless we actually slow the rate of acne formation by reducing our drivers, we're not going to see long-term management. It's the same sort of concept. So it's like, yeah, we can remove cauliflower and garlic and onion and never touch them again, but those things are always going to trigger if those big drivers aren't attended to, and probably more triggers will just come up and come up and come up. Yeah, exactly.
If we don't actually fix the underlying problem. So another good analogy could be, I don't know, in a house where you see mold on the ceiling or something like that, right? And you think, okay, well, it's the mold on the ceiling that's causing us to become unwell. And so we remove the mold with like bleach and stuff. But actually the underlying problem is that there's like the building's been exposed to water behind the walls, the stuff that you can't see, and then that's causing the mold. And so yes, you can remove the mold and kind of to keep on top of that, but if you don't actually fix the underlying problem of the actual structure of the building being waterlogged and moldy, then you're just going to have to keep on top of that and then actually just remove more and more and more mold as well. So it's like that the actual what you see, the mold on the ceiling, is merely a symptom of what's underneath. Same thing, you're bloating, if you are bloating due to a certain food, it's merely a symptom of an underlying thing that's happening in your body, as opposed to being the main driver.
Yeah. So I think to put this into context, and let's start with talking about SIBO, which is small intestinal bacterial overgrowth, bit of a mouthful. All you really need to know is that some of the valves in our gut are not quite functional when other conditions are at play, often like insulin resistance or thyroid conditions or other things like that. So SIBO often comes hand in hand with these sorts of like health conditions. But essentially what happens is the bacteria that should live in our large intestine travels up into our small intestine and causes some of these bloating and digestive issues, is essentially the way to kind of describe it.
Totally. Because in our small intestine, that's where we should be absorbing food, right? So there's heaps of undigested foods in our small intestine. And in our large intestine, they don't exist. It's all digested foods. And so the bacteria shouldn't normally be exposed to these undigested foods, right?
Correct, exactly. And as well, just the quantity of bacteria that lives in our small intestine is just so much less than in our large intestine. That is where they should be living, and that's where, like you said, they start to break down that more fibrous foods that have had all of the good nutrients absorbed out of it, that are a bit more broken down, and that's where they do their magic, break down all those foods. They feed off all the fibre and things in our gut and have other helpful benefits for us. But when they go into the wrong part of the body, then their action is actually no longer beneficial for us. They're doing a bit more damage in terms of this bloating and all these symptoms that we're getting. And this happened for me. So I had SIBO, and I decided to treat it with like a SIBO protocol, which there are kind of two options you can go about this. You can utilize a antibiotic, which is going to kill off the bacteria in your small intestine, but also probably some other bacteria. I'm quite averse to using antibiotics if I don't have to, and if there's always another option, I'll go for that first. And so I tried out this SIBO protocol, which is more of an antimicrobial, utilizing herbs and certain food extracts. Did this like 60-day protocol, And I had such improvement with my symptoms, and it actually has been so well managed. And so the foods that I couldn't really eat much, particularly like hummus was something that I couldn't. And yeah, there were quite a few foods that would just cause me intense bloating. That has just hugely reduced. And so it's like now I have hummus in the fridge and I eat it, and it really doesn't have any effect on me. Or, I mean, I used to wear such baggy loose clothes because I was so fearful that my tummy would distend so much during like a work day that it would just be painful to wear tight jeans or something like that. And so I just don't have that. I don't have to think about that anymore. I don't have those thought things, and I just don't have a lot of the symptoms. Not to say that they don't still come up, but doing that protocol was so helpful for me. And that was the first time in years that I saw actual symptom improvement. I had done the FODMAP diet, which we can talk about. I had done all sorts of different de-bloat supplements and things like that. Nothing touched the surface until I actually addressed the driver, which was SIBO. Yeah.
Talk us through what the FODMAP diet is and how you actually approach that.
Yeah. So the FODMAP diet is an elimination diet that is often typically the first port of call for like a gut nutritionist or doctor will probably point you in the direction of, oh, just do a FODMAP diet if you're presenting with IBS. And so FODMAP stand for like all these different like oligosaccharides, disaccharides. Yeah. So it's all these different types of like
fermentable carbohydrates, right?
That are found in different foods. So they break all of these foods that we would eat, plant foods, up into different categories, and you kind of have to do like eliminate them all and then slowly add them back into your diet. So this means that you have to eat, you can't be eating apples, you can't be eating garlic, you can't be eating all of these like healthy foods. To do it correctly and to actually monitor and see if anything causes irritability in your gut, you have to really do it quite strictly, track it very well. When you do reintroduce foods, you have to have them in very specific portion sizes. It is a minefield and it takes so much work, and it's really energy draining and quite complex, and most people start it and never finish it properly because it just gets too hard. And I guess what I struggle with that too, because I mean, yes, maybe if I could remove all these things, I could see slight improvement, but as soon as I added them back in, we were back to square one again, and it just became frustrating. And it was like, well, it's not fixing the problem, it's just taking away, like we said, the trigger. Yeah. And I think that's the problem that most people who are presented with that find, is that it's like, okay, cool, if this was a cure, like if I just removed these foods and I kept them out for a couple of weeks and I added back in and then it was fine, then I would happily go through this arduous, extensive process and follow this. But the problem is that especially a lot of the foods are really common, like onion and garlic, and that's some of the ones that you... Oh, big time, yeah.
And so it's like, these are in everything. So I now have to just, be so careful when I'm going out to eat, or I feel like I have to tell people when I go for dinner that I can't eat these foods, and it impacts my social life, it impacts how I feel, and it's not actually improving my quality of life much, because yes, I might be having less bloating, but it affects me in what I can eat and everything else. So
every other way, exactly. Yeah.
I think this can offer this idea that FODMAPs are purely the trigger, not the solution, will bring relief to so many people listening to this, because they'll then see, wow, okay, there's a deeper layer, and that's what we want you to look into, is going, there's something that's then causing, like, you weren't born allergic to onion and garlic, trust me, like no one
I used to eat roasted onion, and like my mum would put a entire bulb of garlic on the roast tray, and me and my dad would fight over eating the whole thing. Like I had no problem with it previously.
And so it's like, why has this developed? And then just, yes, removing it. So I think about it like it's a bit of a band-aid. Like removing those foods for a period of time can help the trigger while we fix the problem, because when you eat those foods, it's so painful and distended that, you probably don't want to put yourself in that position while we do the SIBO protocol or something. But it's not the long-term game. It's merely a means to an end. It
reminds me exactly of like using the hormonal birth control pill to regulate your cycle. Like it's really just creating this false narrative. But back when I was first diagnosed with IBS and going through all of these issues, that was the only solution I was ever told. So it was all that I ever believed that I could do to kind of fix it. And at the time, vegetables were still are a huge part of my diet. So that just felt so hard. I really struggled with the whole concept. So I just never really did it properly as well. I mean, I did do it properly once, but just didn't see the results, and then just really struggled to trust in the process again, because I just hadn't seen that. And I think, everyone that I've ever talked to have never found a long-term solution with FODMAPs. And that's why I also am really always quite cautious of, FODMAP recipe books or FODMAP food blogs or all those kinds of things, because it's yes, helpful for the period that you're on them, but don't feel like this is a way of living. Don't think that FODMAP is your life now.
Yeah. It should be it's kind of the same thing with Weight Watchers and stuff, right? Where it's okay, let's significantly cut your calories to help you lose weight, but then they offer you no way out of that. Or no reason for why you've developed that, why you've gained weight, and it certainly isn't because you've been eating too much and exercising too little. There's so many other factors like insulin resistance, but it is that. I feel exactly the same about FODMAP. I said it offers people no way out of that. It's just if you can't adhere to this really, really strict diet for life, then that is a moral failing of yours.
Exactly.
So we talked about SIBO. So basically the bacteria have moved from the large intestine to the small intestine. They're then having a major party because they've now being exposed to all of these fermentable carbohydrates like the FODMAPs and feeding off those and releasing gases and causing this gas in your small intestine. And your small intestine's tiny. Any additional gas in that is no wonder it causes so much pain, because it's just all the pressure on the walls. You can see, when you understand the mechanism, you can see why it causes so much pain. So that's one mechanism. What are the other possible drivers?
Yeah, so interestingly, SIBO, as I said, that's a real cause and something that we can focus on fixing, a driver. But how did I get SIBO?
Totally. And also, how common is it?
So cool. Yeah, really common. We're seeing
I think something like 70% of all IBS cases are SIBO.
Yeah.
I think that's a state.
And another note to point out about this is it's not commonly... It's maybe starting to be more seen, but conventional Western medicine doctors really, a lot of them will still say that's not a thing.
Yeah, even though you can get it tested in the hospital.
You can,
It's very much a thing.
Yeah.
I would say some of the home testing kits they now think are somewhat unreliable, but very much a thing. This is not some woo-woo witchcraft medicine. This is real thing.
There's so much research on it now. Yes, SIBO can arise because of these things, and it can be treatable and it can fully reduce these symptoms. But oftentimes there is actually a few things driving this driver as well. And so we do see a lot of chronic inflammatory conditions really drive this. So hypothyroidism or any autoimmune conditions, higher circulating inflammation, so a chronic inflammatory state, which can come about from obesity, from insulin resistance. These things can all drive your likelihood of SIBO coming to play. For me, because I didn't have my thyroid condition back when all of my bloating and things like this first started, but I can pinpoint my gut issues right back to two things. One thing I think was the trigger that set it off, but travel. So I went to Vietnam. I got very, very, very sick, and then from then on, particularly for the 2 years following, really, really bad bloating, everything like this. This was when I was trying to manage through the FODMAP. Never really found any answers. For a while, it kind of became manageable. I just dealt with it. But then I went back overseas to another country where you're not supposed to drink the water, got extremely sick again, and then that really reared up the latest bout. So what I suspect happened was some sort of parasite that got into my gut, set off all of this issues, and also drove my SIBO particularly. But whether SIBO is at play or not, parasites can cause all of these same IBS symptoms. So again, it's just what are the drivers, and all the presentations of these drivers can be the same: the diarrhea, the bloating, the gas, the constipation, but there can either be one or multiple drivers, just like in PCOS.
Yeah, so true. And the other one that I see really commonly is medications can be a driver of the driver. I see very commonly people telling me that their gut issues started at the same time they went on hormonal birth control.
Or metformin sometimes.
Metformin, yeah. Or Roaccutane.
Yeah.
Is another big one as well. And so, yeah, not that it causes, I mean, that didn't happen to me. I've been on hormonal birth control and metformin, and neither of those things caused SIBO for me. But if you maybe have a combination of factors, or you're otherwise susceptible, they could contribute to that.
Exactly. It's just anything in your body that's really kind of making some of those valves between your small and large intestine kind of leaky. Essentially, that's what's kind of happening to let that bacteria travel. And so whatever things can affect the stability of those valves, which is, like we said, the inflammation, all the other things, they can just add up to make the SIBO worse or not. Yeah.
The one probably big one that I completely forgot to mention in the medications was for people that often get acid reflux, they will take antacids. Because, again, the conventional theory behind reflux is that you had an overproduction of stomach acid, right? And so it was actually, you had too much stomach acid, and it was basically bubbling up over into your esophagus. We now know that is completely false. You don't. But what's actually happening is that is the valve in that esophagus. Again, the valves, really important, but that valve is opening inappropriately and the acid's just coming back up into the esophagus. But what happens is when we do take antacid, it does reduce that hydrochloric acid in your stomach, and hydrochloric acid is really important for maintaining that pH in your small intestine. And this is another problem, is if that pH gets out of balance, that provides a really great environment for those bacteria to move into the small intestine and then overpopulate that. So that's another really big medication that can drive this SIBO production.
Yeah, and then I think just to note as well, while SIBO might not actually at play for you, or that might not be the huge overgrowth, just having the parasites within your gut can wreak their own havoc. So we kind of touched on that before, but oftentimes, particularly parasites, they can lie latent for a long time and then rear their head often when you're maybe run down, or they just come back up to play a bit. So even if you haven't, say, been overseas or done something that you think you could have picked up a parasite, you can pick up a parasite. It doesn't just have to be overseas. That if you kind of had one bout and then continued presentation, that often could signal that potentially a parasite could be at play. But yeah, something to always look into, and something that stool testing can pick up. So yeah, another thing that you can kind of delve into, look into. And we actually have had a client recently who's been on an anti-parasitic protocol because she was presenting with gut parasites. So that was something that's been really positive for her symptoms as well.
Yeah. And I think you're right, is that it's maybe a helpful thing, because often you'll need to work with someone like a practitioner to help identify, okay, what are these drivers for me? But what's really helpful is when you say come to see us, is if you know kind of some of these symptoms, like for example for SIBO, some of the symptoms we're often looking for, apart as well as the bloat, might be, if you have had stomach acid and acid reflux, if you have had pain under the left side of your rib cage is a really common one. If you've had alternating diarrhea, constipation. So if you can kind of keep track of a few of these things, it can be really helpful in your conversation with your medical provider or health provider like us to identify, okay, this sounds like the likely driver of your IBS, and now here's the first treatment plan we're going to go down the route of, or here's the testing that I think we need. So can you explain a bit more how the inflammation and food sensitivities can also be a driver of bloating, apart from, we've covered the FODMAPs, but can food sensitivities other than FODMAPs cause bloating?
Definitely. So there's kind of two pieces here. There's a couple of things like, for example, celiac. We all know that if somebody is celiac, they don't have the ability to break down gluten. They actually have an autoimmune response to gluten being in their system, and it can cause huge gut issues, and people can get very sick. Chronic exposure of gluten, if that's the case, can lead to other serious, I guess, physical issues with the membrane of digestive tracts, like ulcerative colitis or Crohn's or things like that. So that is one piece, and yes, if you are celiac or you have presented with the celiac gene, gluten would be a food that would hugely affect your gut. However, we also see non-celiac gluten sensitivity, which can come up, and this can be similar for other food items as well, but we'll focus on gluten particularly at this point. You might not have the gene, or you might not have those antibodies or autoimmune piece that comes with gluten that celiac does. However, you could have a real sensitivity to gluten when eaten in too higher amounts or too often. So this might be because you don't have enough enzymes maybe to break down that gluten, so you're more susceptible to getting an overload essentially of that gluten. When our enzymes aren't breaking down the foods in our stomach as quickly as they should be, it's okay. For the most part, our immune system can step in and do the job, break things down, clear things out. However, if you are someone who doesn't have a lot of those enzymes, but you are constantly putting gluten into your stomach in potentially large volumes, the amount of immune action and inflammation that comes from immune action happening in your digestive tract all the time is going to start to cause a bit of upset and a bit of chaos. And so that's where you might have something like this non-celiac gluten sensitivity that is still going to present with some of these IBS symptoms, even if you've tested and said, oh, my doctor said I'm not celiac, so I should just be able to eat gluten.
Yeah. And I think that's really freeing for a lot of people to hear, is that because they're like, I know, my lived experience tells me that I get symptoms when I eat this food, right? Yeah. And you're telling me there's no way, because I don't fit this picture of the small amount of people in the world that have a sensitive to, or that are celiac.
Yeah.
And for so long, I remember this has been a really big thing probably in the earlier 2000s, where a lot of people found they did better off gluten, and then there was this big backlash when people saying there's only people that are celiac have any problem with gluten. Yeah, basically. And that if you there's all this talk about, actually if you remove gluten, then yes, of course you'll get symptoms from it. And so I think it's great that we've come kind of full circle now, and we can recognise that yes, some people just are more sensitive to that food, and that's okay.
I do feel like that. I feel like the gluten conversation is so much more harmonious, so much less loaded. It was there for a time. Either you deserve to be eating gluten-free with no judgment, or I'm judging you because you're eating gluten-free. It was like that. People would be like, oh, you want gluten-free toast, do you? Okay. But now everyone's just like, you're gluten-free? Cool, whatever. Yeah, whatever. You do you. You know your body. You've got the authority to eat whatever the hell you want. You don't have to eat gluten. There is so many foods out there that naturally just don't contain gluten. Yeah,
totally.
And actually now there's incredible food products out there for normally gluten containing foods, like pasta, bread, things like that, crackers, that now aren't hugely processed but still don't contain gluten. So, you've got your pulse pastas, or more paleo super seedy breads, or completely seedy crackers and things, and it's they just naturally don't contain gluten. They're not containing gluten stripped products. They just naturally don't have them.
Yeah. Yes, and it's we can still get the same mouthfeel or whatever. We still can get a crunchy cracker, but just made from crunchy seeds. Great.
Exactly.
Awesome.
Yeah.
A much better thing than, as you said, just stripping gluten from wheat, which then puts it into probably the highly processed category, and therefore not great on its own. So yeah, but I agree. I think that it is a much less loaded subject now, which is so freeing for a lot of people that just don't feel great on gluten.
Yeah.
So you talked about the drivers. What are the triggers?
Yeah. So I think something can often set off maybe a flare of this IBS symptom. So whilst I lived with SIBO for probably years, unfortunately, I wasn't bloated 24/7. There were things that would set off my bloating. I didn't wake up with a distended stomach typically. It would be typically after meals, which we talked a wee bit about food triggers being maybe the FODMAPs or something like that. I came from a family of 6, and there was always a fight for the leftovers, or the set going up for seconds. And so you learnt at a very young age to wolf down your meal and get back up in there for seconds, particularly if it was a meal that you wanted. If it was a meal I don't know, mint something that I didn't want, wasn't worried. But in that situation, learned to eat very quickly. And then I was in a boarding house, the same thing happened. It was just a habit that carried over, and it's only been in the more recent years that I recognise that if I wolf down my food, I am 10 times more likely to bloat than if I slowly actually chew my food. that is where I can mitigate probably a huge amount of bloating or triggers of this bloating that could come up for me. Yeah.
So interesting, isn't it? How like that. And so what do we think is going on there?
Well, partly with the chewing. So when you're eating so quickly, you're not chewing your foods, right? And so chewing, that is the first step of digestion for our body. So saliva is filled with enzymes that start breaking down the food before it even gets to your stomach. The chewing and eating of foods really help generate more of that saliva, which also signals to your stomach, hey, gear up, we're getting ready to get food in our belly, to get ready to digest and things like that. So if you are eating too quickly and you haven't had chance to signal to your stomach to let the rest of the digestive system turn on, alert them that it's coming, and also, as I said, start the digestion process right from the start so that the food is already quite well broken down before it gets to your stomach, that can be a huge help for the breakdown in the digestion process. And when things get to the small intestine, there's less breaking down to be done. It's already more broken down.
So water intake can be another thing that can affect those enzymes and stomach acid and stuff. How does that play into a trigger?
For me, this is my personal situation. I was my mum would always say you shouldn't have water with your dinner, but all of us kids always had a cup of water at the dinner table. I've always had to have my water bottle with me at meals. I almost had an anxiety, and I think it was because I ate so quickly. I felt I had to wash down the food maybe as well. It was just I had poor eating etiquette, even though manners were drilled into me. Poor eating etiquette for my body. And so something that I've really learned to do now is really minimize, unless it's absolutely necessary, I try not to drink during my meal, because what that's going to do is, like you said, really dilute the stomach acid and dilute those enzymes. And really what we want is the right pH in our stomach and in our saliva to really help fast track the breaking down of those foods. So sometimes if you're finding you're drinking a lot of water whilst you're eating meals, that could contribute to bloating for a lot of people, particularly if they're carbonated beverages as well, because whilst they can feel really nice to drink, you're naturally putting gas into your stomach, and it can cause a lot. I mean, you'll know that you have a drink of fizzy drink and you typically belch, but it does drive a lot of extra gas in your stomach that your body has to deal with. Yeah.
And I remember you saying this. You're saying I was always so fearful of drinking fizzy water at work because that was just a recipe for bloating for me.
Yes, yeah. Happy to drink it after work at home, but I wouldn't drink it normally during the working day. It would just be not right now. Again, I don't want to feel stretched in my tight jeans. Yeah.
Do you think there was also anything else going on there? I know there's a big connection with stress being a bit of a trigger for this. So it's that when you're in that more stressful situation, you were more prone to those foods?
Yeah, it's interesting. Definitely. I never really tracked it because I wasn't aware, but I would, looking back in hindsight, absolutely. I would get extremely bloated when I'd go out for social occasions, extremely bloated. And I think that was a social anxiety trigger. So I would fear more so going out because I would be fearful of bloating, but then I would also bloat because I was so fearful of the whole thing and just fearful of social environment. So yeah, that's something that I've in hindsight really recognized, but it's not something that I knew at the time, and I wish I did. Yeah.
But all these things that we're talking about here is the triggers. I mean, these are all part and parcel of what we do in the SIBO module as well, is going through, and often first, before we get into an antimicrobial protocol, but actually just going, right, let's actually slow your eating down. Let's chew more. Let's play around with that water intake. Let's think about stress, and that can be enough sometimes for some people.
Let's attend to the basics, yeah, and that can be enough to really feel like it's manageable, because undertaking something like a SIBO protocol might feel a little too far, or going to see a gut specialist if you're this is something that's happening for me right now, but I'm not sure that I really want to invest incredibly in terms of time or money into this. It's not at that breaking point for me yet. These are some extremely powerful things that you can do to really just mitigate the amount of bloating and gut issues that you're experiencing. Yeah.
And they can feel so, you said powerful, but they can feel so basic, and therefore it can be hard to trust that they could have an impact, especially if you've gone down the route of going to eliminating foods and things that are way more sort of tangible and feel a bit more extreme. And it can kind of be hard to trust and go, oh my God, like really? I've done all these other way more intense things and that haven't solved my problem. Like, how can chewing slower really improve those symptoms?
But yeah, exactly. It feels basic and it feels backwards, but like sometimes the simplest things are like the most effective. Yeah.
And we've seen this so many times with patients, right? Like and it's so funny because we always suggest it. You can kind of see the internal eye roll.
Yeah.
And then sure enough, like 3 weeks later, it'll be like, oh yeah, done those, actually made such an improvement. And I was so skeptical. I was like, and then we're like, yeah, we get it, don't worry. Like, we're not naive to know that we would also find these things really basic. And so it's...
And if I'm like, I've paid for a specialist to, you know, to give me help, and they're turning around and saying, chew your food, I'd be like, what?
Yeah, totally. And but it is amazing how sometimes just doing these small things and doing a combination of them and actually that it's allowed to be easy. Like sometimes you can feel like with your health it has to be hard, it has to kind of be like
we do
sacrificing,
it, yeah,
and that you're kind of like making these big sacrifices, like I'm removing all these foods and actually so then there can be a bit of tension when it's like, oh okay, that feels a bit easy, to then be like
well, I think psychologically, like, exercise is incredibly hard, dieting is incredibly hard. We have this preconceived notion that health is hard work. You have to put health above everything else. But it's like, do you know what's the easiest thing to do in the world? Like, sleep. And that is one of the best things you can do for your health. So like, it doesn't have to be complicated and it doesn't have to be hard or painful. And yeah, so I think don't discount like those simple things.
Yeah. And the next part is don't discount that these could be having an impact on your other PCOS symptoms and drivers, because I know it can seem very far-fetched that your bloating could be triggering your like hair growth or but again, when we're talking about these underlying drivers, like okay, if you've got something like SIBO, then yeah, we know this can contribute to your underlying drivers of PCOS, like your insulin resistance. For example, just this morning I've been interviewing Dr. Lara Bryden for the podcast on her new book, which has actually got it right here because we've just been doing it, The Metabolism Reset. And in there, Lara actually does a really good job of breaking down how SIBO can trigger insulin resistance. So one of the ways is that when we have these issues with our gut, so the underlying problem like SIBO or parasites can cause a condition called leaky gut. That's the common name for it. The more medical name's intestinal permeability. So your gut's made up of all these cells that are tightly packed together, and they have a junction called the tight junction between them, and that junction is supposed to be tight, like the word, right? And so what can happen though is those junctions open inappropriately and then let things in. So those, basically, if you look at the outside of your gut, it is back to back with one of your blood vessels. And this is how we absorb nutrients, right? Is that we absorb it through the gut lining and straight into the bloodstream, and the bloodstream can then deliver it around. So it's kind of like the motorway on-ramp onto the motorway, and then the motorway takes it around the body to all of our vital organs. And so that's when it's working perfectly. It is a beautiful system. It's been so well designed. But what happens is when those tight junctions are inappropriately open or leaky, is that other things that should never make their way into the bloodstream, should be excreted out our poop, they accidentally get in there. And so this could be like large molecules that haven't been broken down, or it could be other, like, I don't know,
they
other
call
things.
Them endotoxins.
Yeah, endotoxins, yeah. So
toxins,
it's things that your body and your immune system will react to and be like, bah, those are not supposed to be here. Like this is...
It's like if
Alarm.
COVID got into your bloodstream, your body would be like, bah, immune system, go. Same thing with these toxins, like, or bacterial pieces or large molecules. They're not supposed to be there. Body reacts. Yeah. And
body reacts. One of the first parts of your immune system is inflammation, and so it sends inflammatory. It starts the inflammatory cascade. So we go into this chronic state of inflammation, because the problem is that we just continually exposing our body to these large molecules. And this is where maybe that when we're talking about that non-celiac gluten sensitivity, this is probably what happens there, is that those gluten molecules are making their way into our bloodstream, which shouldn't be like directly going into our bloodstream, and then our body's reacting to them. So you're not celiac, it's not an autoimmune response, but it is definitely an immune and inflammatory response. And so we've got this. When we've got chronic inflammation, then that can lead to be a driver and trigger for insulin resistance, or as well as other things as well. So that can be one way that maybe this underlying gut issues are then connected to your insulin resistance, which is then driving your PCOS.
Yeah.
Another way would be in terms of what happens to your fat cells that surround your organs. These are called your visceral fat cells. So what happens there is that if you have something like SIBO, these fat cells get bigger in response when you have SIBO. These fat cells get bigger, and then bigger fat cells there contribute to abnormal hunger, and so this could lead to weight gain, insulin resistance, and again those underlying parts of PCOS. That was a very, very, very brief explanation, but just to give you some context about like, okay, how could my hirsutism be anywhere related to my gut symptoms? That's the connection.
So just like you were saying, Claire, with those like tight junctions and how in a perfect world, in that perfect system, those nutrients absorb are the only things that really pass through our gut lining into our bloodstream to help us get all the goodness out of the food that we're eating and send it around the body. But what can happen when we have got these gut issues or additional inflammation in our body or this leaky gut, the ability for those nutrients to pass into our bloodstream can be really impaired. So we can often see when there is IBS present, really low, chronically low levels of nutrients. Oftentimes iron becomes really difficult to absorb, and so low iron or anemia comes to play. Vitamin B12 would be another one. All of those important nutrients, we really start to see a lot of nutrient deficiencies, which we need all these nutrients for all of the reactions that happen in our body. We're not just absorbing them for the sake of it. Like, they are the keys that turn on all the processes in our body. So if we are lacking those, no wonder the body gets sluggish, energy goes down, we just can't function as optimally. So it's really important to get on top of a lot of these IBS and gut issue symptoms, because they actually can really impact the rest of our health, just like we've said about some of those other things. So that can be a real, I guess, you might be like, I can deal with the bloating or deal with a little bit of discomfort, but it's also like, do I really want to let this jeopardize the rest of my health as well? Yeah, like that's like a wee question that I pose to you.
Yeah, totally. And you're right. Like, I think that there are some people like you and Sophia who used to work with us as well, she's now an amazing registered nurse, but she, it was really affecting her quality of life, like to the point where she had to...
She stopped working.
And quit her job. And then when she came to work with me, she was only able to work like 3 days a week, and as she kind of got better. So it was like such an impact on her quality of life. Whereas other people, like I've definitely had bloating in my life, especially when I was at university. Like I distinctly remember after lunch getting quite bloated, and interesting, this would be the time that I would have gone on the hormonal contraceptive pill and other things.
Higher stress when you're at university.
A lot higher alcohol.
It totally, we haven't even touched on alcohol, but that's a subject for another day, but just know that that can also contribute to
yes, exactly. Like probably I was living in a university, like hostel hall of residence, so maybe food quality wasn't as great, like
bacteria,
yeah, so all that sort of stuff. But it wasn't ever really severe. It wasn't ever really affecting my quality of life, and it wasn't always present or dissipated. So I would be in the camp of like just kind of dealing with it, right? But knowing now what I know about like the reduced, like nutrient absorption and how it could connect to insulin resistance, that would have been a big thing for me. We're going, oh, okay, yeah, I do have to really take this seriously and fix that and get to that underlying cause.
Yeah, and the research in this space is forever emerging. Like the gut has just been, in the last 10 years or so, the amount of research in this space has just been unfolding, because the gut is so directly linked to every aspect of our health, like our brain health, mental health, like all of these things. But a lot of the research has been showing like poorer gut or bacterial compositions or things going on in our gut are a big driver for metabolic syndrome in later life, or a big indicator that could come up to play. And so this kind of just really feeds into why like looking after our gut and really kind of getting to the bottom of some of these bigger gut disruptors can be so vital for like other areas of health.
Hence the reason I am so
worried about flossing.
Because that's that is the treatment that she's been given. It's like you've got these chronic ear infections, they're not clearing. Like, we will leave them for like a couple of days and see if your body will clear them on their own. She has got grommets in there, which is like a tiny little, like, I liken it to like a little micro sewing bobbin. It's like a metal outside and it's got a hole in the middle just to help the air drain. And she was a C-section baby. She has got constipation, she has had to, have rounds of antibiotics before we got the grommets in. So all signs are pointing to there's some gut issues here and some other things, and maybe some dairy sensitivity that's been developed. But I want to stop this now. It's like we went down the path of, as I said, she had eczema when she was a young baby. She developed eczema after about 3 weeks, when she was 3 weeks old, and it got so bad that she was bleeding. It was basically covering her whole torso. And we don't have a strong family history. Her great-grandmother, I think, had it, but is not a really strong family history. And we were told, basically when it was started to bleed on her torso, her doctor said, right, now she's got to be on cortisone, steroids. And my response was, okay, I'm happy to do that to repair the barrier once, but then I don't want to continually use this because I've seen the ramifications of people having to come off cortisone later in life and all of the challenges and awfulness that comes with that. So I want to actually fix the problem and fix the driver. And his response was, there is no cause clear. This is just a genetic, this is just her lot in life, and that's it. And I was like, okay, thank you for your opinion. I don't agree, but I understand that's all you can give me, so I'm going to seek advice elsewhere. And it was amazing. We got onto a great homeopath I talked to lots of colleagues in different modalities. I talked to a colleague in Chinese medicine, one who just does acupuncture, and I said, would either of these work? And they said, nah, she's too young, she's younger than 6 months, too young, try homeopathy. And we did, and within 2 weeks, completely clear, and she's had one relapse, but that's all to do with the underlying trigger that the homeopath also suggested was the cause. And so it was amazing to us that we saw, again, it's just, I'm a big one for taking bits from different. I don't think that any modality.
Is a consultant, and taking what you can from each one. Yeah.
But a big thing for me was I want to utilise these different modalities who have different lenses to view the problem and find one that her body responds well to, so that we actually fix the underlying driver of this eczema as opposed to just treating the symptom. And it was so interesting because my partner, he was like, I was so sceptical of what you were doing, but I let you go because I know this is your bag.
I mean, you've done functional medicine training. Your whole ethos is find the problem, find the driver.
Yeah. But he was like, I was still real sceptical. Yeah. But he was like, I cannot fault it, right?
Yeah.
You've 100% proven that was the right method to go down. And so now we're doing the same thing with the ear infections and stuff, is trying to, again, find that root cause. Because I've been, I was a tonsillitis kid. I've then seen that, when they just removed the tonsils, now I then was really vulnerable to chest infections. And so I've kind of seen the ramification. If we don't treat the problem, if we just kind of kick the can down the road, then it's going to catch up to us later. And I don't want her constantly exposed to these antibiotics, because I see that's exactly the same problem. We're just perpetuating the problem and maybe pushing it into a different symptom. Yes, we might clear the ear infection immediately, but we're just setting her up for metabolic dysfunction later, or some other issue later, which is just as severe, if not worse. So if this sounds like you, then there is a way through. That's what I want you to know, is that this is not just your lot in life, that you have IBS and bloating and you just have to live with the discomfort and live with the impact on your quality of life, that there is something you can do about it. There's always drivers, and there's always different treatments. We can help you through that if you want. Whether that's affecting your PCOS or not, it doesn't matter. We can still help walk you through what's likely the driver. And in some instances like SIBO, we can help you work through that treatment. If it's something else like parasites, we can refer you on to the right person to work with you for that.
Completely. Mm-hmm.
If you're finding value from these podcasts, then we'd be so grateful if you could hit follow on the PCOS Explained podcast. This means that not only you'll get the latest releases, but also that other people are more likely to find this podcast. That's the way the algorithm works. And we all know how important it is to get good information about PCOS. So if you can hit that follow button, it means that people with PCOS that don't know that this podcast exists are more likely to find it. So thank you so much for your help there. Now stand by for our disclaimer. The information contained in this podcast has been prepared for the purpose of providing information, including about the PCOS nutritionist products and services, and is designed to support clients' overall wellness. It is not intended to provide medical advice or designed to rectify, treat, or cure any specific medical conditions or diseases. Nothing stated or shared in our podcast is intended to be and must not be taken to be medical advice. Please seek the advice of professionals as appropriate regarding the evaluation of any specific information, opinion, advice, or content contained in our podcast.